Chapter 8 is preparation and administration of medication. So this chapter is going to go over the correct way of how to give certain meds. All right, slide 2 got traditional packaging. Traditional packaging would be in just a regular old bottle with loose medication in it. Usually what we go and pick up from the pharmacy. That's traditional. Then we have unit dose packaging. That's a single dose of medication. It's sealed in plastic and it has a foil backing. And then we have blister packs. These are your blister packs. I call them bubble packs. So it has multiple doses and they're all individually separated. Okay. So these are what you're going to mostly see in the nursing homes or assisted living, as well as now the strip packs. But at your facility, they have it's still kind of sort of like this, kind of, but they're in like some kind of container, something. You'll see it when we go tomorrow. All right, slide 4. I want you to highlight both of those statements. No matter the system used, MAs must always administer only medications that are listed on the MAR according to the instructions, and they must document all medications that you have administered or that were refused. You should never administer medications you did not personally prepare. An example of that would be if you're at, say, you're at work and you were on break and your nurse were drawing up some insulin to give to a resident, right? You come back right before she was going to give it. And she said, well, hey, I just drew this up. You can go ahead and give it to her. You got to say no. You say, no, I don't know what's in there. I didn't personally prepare it. When she said, well, this is just insulin, I'm not comfortable with doing that. You got to protect your certification because everybody else is going to protect theirs. Okay. You always want to make sure on slide 6 that you are washing your hands. You're performing hand hygiene before your med pass, during your med pass, and after your med pass. Make sure you're using your hand sanitizer in between residents. Make sure you are wiping down your crush device. Whatever you're using to crush, usually facilities have silent nights, or sometimes you can have these little individual ones. You'll usually see these at the hospital now where they have their own individual crush. And then you just place the peel in here. Place the peel in there, and then you just continue to twist it. And so if you turn it, you'll start to see it's crushing it now. Okay? But you need an order for that. You need an order to crush meds. So even after I use this, I gotta clean it. Okay? Because you can still see some remnants in there, even on here. So I don't want to run the risk of putting somebody else's medication in here and crushing it, and then it still have medication from a previous resident, because you're essentially dosing them. Okay, so always clean these out before you crush somebody else's medication. Okay, so you performing your hand hygiene. Also, when you are getting your cart, let's just say you just got to work, you just did rounds, make sure you do a round, meaning your shift change report. You need to go over every resident. You need to go and put your eyes on your residents because you need to make sure they're still alive. I'm just being honest. Make sure they're still alive. And then you need to discuss any changes in medication. Were there any medications that were DC? Were there any medications that were started? There any medications that need to be kept taken off the cart? These are the things you are discussing with the other medication aide. Okay? Since you're new working at these places, you need to know who's all get crush medications. How do they take their meds? Right? What way do they take their meds? Okay? These are all things that you need to be mindful of. Okay? Wearing your gloves again on page slide 9. Make sure that you are wearing your gloves. Do not touch pills without your gloves. That is contamination. Slide 11, you don't want to rush your residents. You want to encourage independence. So if they can do something for themselves, let them do it. If they can administer their own inhaler, give it to them. Let them do it. We need to make sure they have on their communication devices. So hearing aids, they need glasses. Okay. Make sure they are positioned properly, depending on the type of med that you're getting ready to give. Make sure that your cart is stocked with your puddings or your applesauce that you're going to use. When you come in, wipe the cart down, bleach wipe it down. The top, the handles, all of that. Your Silent Night crusher, you wipe everything down because sometimes you got people that don't practice hygiene, hand hygiene, right? They could have just taken somebody's blood sugar and blood dropped onto the cart. Okay. Every time you come in, wipe it down. Make sure you got fresh water. Take the pitcher. You need to clean it out. Those pitchers need to be washed at least twice a week. Take the pitcher, put your ice water in there, and then you need to get a sticky note. And this is a federal and state requirement. You need to have the date and time that you changed the water. Tape it to the pitcher, the water pitcher. If you're using applesauce and pudding, once you open it, what you think I need to tell you to do? Date and time it. And usually for me, if I open it and it's been a 12-hour shift, at the end of my shift, I'm throwing it away. I'm throwing it away. And then I just make sure to restock my cart for the next person. Make sure they have enough spoons, they have enough straws, they have enough cups, drinking cups, med cups. They have everything that they need to function on their shift. If you do that, that is called cart etiquette. If you do that, they're going to do that for you. Okay? Pull the trash. Make sure that it has an empty trash bag in there now. Okay? All of that is cart etiquette. When you're passing meds, do not have drinks and food on the top of your cart. That's a state and federal regulation. If JCO or a state walks into your building and sees that, you're going to be cited for it. That's an infection control issue. Okay. Okay. Slide 12. I want you to highlight the first bullet point. Only administer medications that is on the MAR. You never crush a medication unless you have the order to do so. You want to suggest placing tablets on towards the back of their tongue for easier swallowing. Give them some additional fluids. Okay. You can even offer them water before they put the pills in their mouth, just in case their mouth is dry. That way that the pills will not stick to the tongue. Okay. Slide 14, I want you to highlight the second bullet point. So these are the three separate points that you are to check your meds. Three separate points where you are going to compare the pill pack with the MAR. Okay. The first time that you're going to be checking is when you are removing the pill package from the cart. I take it out and I'm looking. I'm making sure I got the right patient, the right medication, the right dose, the right route, the right time. Everything is adding up. Okay. The next check, I'm putting the pill into my cup. I'm still checking. The third check is when I'm putting this back into the cart. There go three chances that you got to catch yourself before you commit a med error. Three. Okay. Use all three of those chances. Again, comfort will breed med errors. Because yes, you are going to get to a point where you're going to know the MAR front and back. Because in these facilities, nursing homes, assisted living, their medications rarely change. It's either they're going to get an antibiotic, they may get a little change in certain medications, whether it's their blood pressure med or something like that. But their medications are not just drastically changing. Okay. So you're going to start to know, oh, I already know what she gets without even looking. That is going to lead to an error. Because what if you're coming in on night shift, during the day shift, one of their pills were discontinued? The order called, the physician sent an order in and say, hey, I want to discontinue this pill. But that CMA or that medication aide or that nurse forgot to take that pill out of the pack, And when you got there, they forgot to tell you during shift change. So now, out of habit and comfort, I already know tomorrow you're gonna go by comfort and by habit and start just putting pills in there that you remember, not knowing that last pill that you put in there that we no longer have an order for it. So check, check, check until you can't check anymore. You want to avoid distractions while you are preparing medications. Okay, this is going to protect your resident and you. Okay, go to slide 19. So when we are handling our liquid medications, just like on here, how it has a label on it, your other liquid medication will have a label as well. So whenever, and you can see where the liquid actually has gotten onto the label, but you can still read it. So I can still give meds out of this bottle. I can still read the actual order. So I can still give meds out of here. But let's just say that so much leaked out of this bottle that I can't read this. I cannot use this bottle. If I can't read the order on the bottle, I can't use it. So what will happen is I will have to call pharmacy, or my nurse will have to call pharmacy. I'll report it to my nurse. And then she could call pharmacy and say, hey, can y'all send us another label for such and such amoxicillin bottle? The other one has been messed up. We can't read it anymore. Because if you don't do that, and everybody said, well, we already know the dose. We ain't worried about that. Everybody's still pouring. Each shift, still pouring. Pouring. Guess what? State gonna walk in the building. Guess what? And they gonna do a med pass with you. And then you're over here with this bottle and you can't read the order and you're just pouring. And she's gonna say, oh, do you know how much to give? Yeah, we've been giving that. But you can't read the label. Y'all are gonna get cited for that. Okay? So you have to protect the label. And the way to do that, when you're pouring the liquids, always make sure that the label is facing the palm of your hand. So I'm going to put the label like this. So I'm protecting it. And then I'm going to pour this way. Pour away from the label. Okay. You always want to make sure, again, that your cup is on a flat surface. And you're going to measure it at eye level. Just like that. If I hold it up here and pour it in, I can probably give them too much. Okay. So always sit on a flat surface and pour and measure at eye level. Put in the label to the palm of your hand. Okay, always pour away from the label. All right, so that is the 4th bullet point I want you to highlight on slide 19. And then highlight the 5th bullet point about the medication cup must be on a flat surface. Slide 20. If you ever have a question about medications, always go and ask your nurse about it before you administer. Okay? Don't administer drugs that you are unfamiliar with. Always check your expiration dates. Never borrow from another resident. Residents with these cards, and what they mean about borrowing, if I got 2 residents that are on Protonix, 60 milligrams or 40 milligrams, and one of them has ran out because we didn't order the medication in time, Mr. Smith got a card. Go ahead and steal one of Mr. Smith. That's borrowing, okay? Yeah. It's really stealing because you technically don't never give it back to them. So you can't take somebody else's medication because their insurance paid for this. And now you just took a dose from them, so now they're going to run out sooner than they were supposed to. So when you're looking at these packs here, you'll see this blue strip here, and it says reorder. Whenever I get close to it, I need to go ahead and reorder. So I'm calling pharmacy. Hey, she's getting ready to run out of her Protonix. Can you send another card? That way it'll be in the facility, because per the state and federal regulations, there is never a time a resident should go without meds. And what I mean by that is this has nothing to do with them refusing. This has everything to do with we didn't order it in time. So then when you document in the system, it says med not available. What do you mean it's not available? Who didn't order it? So now they're not getting their very important medication because the staff failed to order it in a timely manner. That will never fly with state. So, and depending on how often they're taking it, some of these people are taking 2 pills at a time. So they're going to finish this card a lot quicker. Whenever it is nearing, don't wait until it gets in the blue. Order it before it gets there. I will order it when we're on this line here. Go ahead and say, pharmacy, can you send me in another dose for such and such, blah, blah, blah. Another card. She's getting ready to be out. Okay. Okay. All right. On slide 26, you will see the correct position for administering oral medications. So you want to make sure that the resident is in high Fowler's. High Fowler's is a 90-degree angle. She is sitting upright. Okay. In this position here, this is going to protect her from choking and aspirating on her pills. Okay, so all your residents need to be sitting up, high Fowlers, 90 degrees, so they do not choke. Okay. On slide 31, you will see where if we have to administer oral disintegrating tablets, these are the 2 ways that we are going to do that. So, looking here, you got buccal. Buccal, I'm placing it between the cheek and the gums. Sublingual is going right under the tongue. Okay. Okay. All right, slide 36. So here, our patient or our resident is using an inhaler, but it has a spacer on it. So that chamber, that attachment that is on the inhaler, what it does is once you press the canister, it's going to release the medication, but that spacer traps it. So it traps it to give your resident enough time to breathe it in, because when you're using inhalers, you have to breathe in deep because the medication has to reach the base of the lungs. Okay, so they're going to breathe it in slow and deep. So again, that spacer is there just to give them enough time to breathe in the medication. Okay, on slide 38, you will see the inhaler without the spacer on there. Either way, whether they're using a spacer or not, they need to create a tight seal around the mouth of the device. Okay, that way so that the medication does not escape out of the sides. Okay, before you give the inhaler, you have to remember to shake it. If you have to give them more than 1 dose of the inhaler, you have to shake it before every administration. So if I got to give them 2 puffs of their inhaler, I'm going to shake it, deliver the first puff, shake it again, deliver the second. Okay. Slide 39, I want you to highlight steps 14, 15, and 16. So when the medication is inhaled, you want to ask the resident to hold their breath for 5 seconds. 5 seconds. Okay. If I have to give them a second dose, I'm going to wait 1 minute in between each one. And remembering to shake the inhaler again. Okay. So I'm going to give 1 dose, wait a minute, shake it, give the other dose. Okay. If it has a corticosteroid in this inhaler, I need to have my resident to rinse their mouth so that oral thrush does not develop. Okay. So that is inhalers. Next, we're going to go to nasal medications on slide 43. I want you to highlight step 7 on slide 43. All right, so when we are giving nasal medications, okay, we want to make sure that if we're giving a spray, we can raise the head of the bed, so sit them up, okay, and then their head can be tilted slightly. If I'm giving drops, they need to be laying flat, because if you try to give drops while they're sitting up, it's going to drop out. So just remember that, okay? So highlight step 7. When we are giving the nasal sprays, you want to make sure to shake it, and then you want to place it right there in front of their nair, in their nostril. Right? And then you're just going to tell them, all right, on the count of 3, I'm going to release the medication and you need to breathe in. Okay. All right, slide 48. So when we're giving eye medications, okay, when we're giving eye medications, you want to make sure, of course, to have on your gloves. And when you are dropping the eye drops, you want to make sure to not drop the, well, first, you want to make sure to not touch the tip of the applicator to the eye. You don't want to do that because what if they are developing conjunctivitis? We don't know it yet because their eye isn't red. We haven't seen the crush form yet. And I make a mistake and touch this to the tip of their eye, and then I move to the next eye. So now I just transferred that infection to the other eye. Okay, so you never allow the tip of the applicator to touch the eye. And also, when you are administering it, it goes into the bottom lid here. So you want to use your little pinchers here. So my index finger is going to hold up the top lid while my thumb is going to hold down the bottom. So you're holding the eye like this. Okay. Then you're going to drop the eye drops into the bottom lid. You don't drop it directly onto the eye. It goes into the lid down here. Okay. Once I put the drop in there, you see that second picture on slide 48 where she's just putting her finger here, right here in the middle. You usually use a Kleenex to do that. You put the Kleenex here. You're doing that because you have a duct, D-U-C-T. The duct is an opening, the opening to your bloodstream. Some of these eye drops cause systemic reactions, and we don't want that. So in order for this to not enter into the bloodstream, you occlude the inner part of the eye. You don't put a lot of pressure on there because you can ultimately cause this eye to pop out of socket. Now you got to try to put it back in. You're going to be able to do that? Okay. So you take the Kleenex, you hold it right here after you put the eye drops into the bottom lid. You hold it there for 1 minute. Light pressure. Barely there pressure, okay? And then if I have to give 2 drops of my medication, of my eye drops, I need to wait 5 minutes in between. Okay, so I'm going to give that first drop, wait 5 minutes, give the second drop. Okay, so you should have highlighted step 10 on slide 48. I got to call you back. Okay. Okay. All right. For eye ointment, you're just going to do the same thing, but you're just doing a ribbon across the bottom lid. Okay, just a ribbon. All right, for your eardrops on slide 53, when we're giving eardrops, before we do that, we want to make sure that our patient is laying in a lateral position, whether that's right or left. So they need to be laying on their side, or we can just turn their head to the side. And then we have to position their ear. You always want to position the ear going up and back. See that? Up and back. Okay. This is going to straighten out the ear canal. And then once you put the eardrops in there, it should run along the side of it. If you do not position the ear properly and you just put in the eardrops, it can cause trapped air. And then now we got an ear infection. So position that properly. After we instill the eardrops, they have to remain in place for 3 to 5 minutes. So on slide 53, I want you to highlight steps 8 and 9. Also, with your eardrops, you can, after giving it, put a little cotton ball there. You don't push it into the ear. You just let it sit there because they're already with their head to the side. So you just let the cotton ball just sit there. Don't push it into the ear. Okay. Um, 60, slide 60. If you ever have to do a warm soak, just want to make sure that the temperature of the water is at least 105, no hotter than 105 to prevent burns. Usually if you have a soak, it's probably going to be Epsom salt or something. The order would tell you how much of that medication to put into the water and how much water to use. And then you just stir and mix it up until it's completely dissolved. Slide 64. That goes back over our patches. Just want to make sure, highlight step 10, that we must have our time, date, and initials on the patch. Okay. Slide 65 shows you how they're removing the film on there and applying it to the skin. Remember, you want to rotate sites unless it tells you where to place the patch. Okay. All right, slide 68 goes over suppositories. So, highlight step 6. So, if I have to give a suppository or even an enema, if I have to give a suppository and enema, I want to make sure to have enough lubrication because it's a very uncomfortable procedure. And then make sure if you are carrying a suppository, do not put it in your pocket. Your body heat is going to melt it. Okay. You want to lay your resident in the left-sided Sims position. So you will see that they're laying on their left side and their right leg is flexed. This is going to give you a great view of the rectum area. Before you insert anything, you need to look for hemorrhoids, any abnormalities, and you need to go and report that before you stick anything into them rectally. So here, if we're using an enema, you would just take this top off. And usually what I do, I'll cut off the top of the lubricant and just stick the whole pack on top of the nozzle. And I'll carry it to the room like that. I'm trying to put all of this lubrication on there because, again, this is uncomfortable. Okay, so trying to make it as easy as possible. And then you sit there and you squeeze this in slowly. This should not be cold. It needs to be room temperature. You never insert cold fluids into a resident. They can experience shock. So this needs to be at room temperature. You're going to squeeze it in slowly, but you have to keep reminding them not to push the medication back out because that's a natural reflex. So they have to hold it in so it can be absorbed into the rectum mucosa, and so it can work. If they just pushing it back out, it's defeating the purpose. Okay, so you need to know that they need to be in the left-sided Sims position for suppositories or enema administration. Okay, you want to insert it with your gloved finger and push it in. I would say go up to your knuckle, okay, about 3 inches. Push it in and tell them to hold it in. Another practice that I would have, I would take them to the bathroom first because you don't want to put them in this position, put the suppository in, and then next thing you know, I gotta pee. Listen, you can't get up right now. Okay, then if they get up, it's just gonna come out. Okay. The same thing goes for vaginal on slide 71. You need to highlight step 6. So with vaginal suppositories, the position that they need to be in is the dorsal recumbent position. So that's on their back with their knees flexed. Okay, it's going to give you a good view of the vagina. Before you place anything in there, you need to look for anything that is abnormal, discharge, odor, anything like that that I need to report. Okay, step 10 on slide 72, I want you to highlight that. You need to insert the suppository or applicator 2 to 3 inches into the vagina. 2 to 3 inches into the vagina. Okay. If you're using an applicator, you want to place the plunger in fully to release the medication, then remove it and discard the applicator. You don't reuse it, okay? Do not force the applicator into the vagina if you meet resistance, okay? If you are unable to insert the applicator, go and tell your nurse. Slide 74, never document something that you did not do, including documenting for another person, okay? Don't document before you complete a task. Always check that you have performed and documented every task, especially at the end of your shift. Check yourself and recheck yourself. Okay. Document any resident refusals, stating the refusal, why they are refusing. Okay. Use only black ink if you're using paper charting. You want to document any observations and resident reports of side effects and adverse reactions. Okay. And then if you have to correct yourself after writing on like paper charting, if you made an error, you don't scribble it out. Scribbling looks like you're trying to hide something. You only put a line through it, put your initials and circle, and then you write whatever is the correct thing. Okay. All right. So that will conclude chapter 8.